Hey everyone, my name is Vanessa and I'm a second year physician assistant student working with Heart, Women, and Girls to answer your questions about sexual and reproductive health. A question that we get a lot is about the HPV vaccine and whether that's something that you or someone in your family should consider. So let's get you the information about HPV and the HPV vaccine so that you can make an informed decision when the time comes. HPV is short for human papillomavirus. It is the most common sexually transmitted infection in the United States. People can get infected with HPV if their mouth or genitals come into contact with the mouth or genitals of someone who has HPV. Genital warts reflect an HPV infection, but this is not the same type of HPV that can lead to cancer. Most people infected with HPV never show any symptoms. If you're a woman or woman-bodied, your doctor may check for HPV on a routine pap smear, which you should start getting at age 21 because they help detect precancerous cell changes in your cervix. If you're a man, there's currently no way of testing you for the HPV strains that cause cancer. HPVs are a group of 150 related viruses that are grouped into two categories. There are low-risk types and high-risk types for causing cervical cancer. The low-risk types only cause warts and not cancer, and the high-risk types are responsible for 2/3 of all cervical cancers and close to half of all anal, vulvar, and vaginal cancers. So this is no joke, y'all. Approximately every year, 17,600 women and 9,300 men are affected by cancers caused by HPV. So what do? The HPV vaccine has proven to be 97% effective in preventing all vulvar, vaginal, and cervical cancers caused by the highest risk strains of HPV. The HPV vaccine, Gardasil 9, covers the most common types of HPV strains that lead to disease and cancer. It's given as a 3-shot series over a period of 6 months, anytime between the ages of 9 to 26. After age 26, your insurance will not cover the cost for this vaccine, but if you are not sexually active and over 26, it is something to consider paying out of pocket for. There's all sorts of paranoia out there about vaccines, but it's important to note that in the US, years of testing are required by law before a vaccine can be licensed, and once in use, a vaccine is continually monitored for safety and efficacy. Lastly, you might be thinking, well, I'm not sexually active, or my son or daughter is not going to be sexually active anytime soon. It's important to remember that this vaccine is most effective if given before an individual ever has sex. Nearly all men and women who have ever had sex will get one kind of HPV at some point in their lives. That being said, everyone is at risk for the potential outcomes of HPV. So that's it for me. I hope that you feel more informed about HPV and the potential benefits of the HPV vaccine. I'll link some more information down below, and you can always visit heartwomenandgirls.org to ask any of your questions regarding sexual or reproductive health in a culturally safe and sensitive space.